While we're sort of changing places, the one person who hasn't been able to make it this morning is Steve Mastery from RTI Broadcast. And that might answer one of the questions that Rory has raised about costs and transmission. I have to declare an interest here in that I have a partnership with Steve Mastery selling very excellent Italian transmitters. An important part of the argument we've been putting forward is that if there's going to be local partnerships, they must own the means of production and the means of transmission. That if it's owned by some national body and then give it up downstairs, it's going to be phenomenally expensive and destroy the model. And one of the things that I'm sure Dan will confirm from our experience with analog local TV, it was also contracted to NTL, and NTL charged a disproportionate amount of money for those transmission facilities. So the station that I was involved with in Portsmouth, we were paying them £60,000 or £70,000 a year for transmission. I do know because Steve, hopefully, somewhere in his papers, has a paper he took out when he left NTL, which shows that NTL were in profit in their investment in local TV transmission within 15 months. So on an 8 to 15 year agreement, they were in profit for 90% of the time. What I'm saying in this context is that there is an opportunity to do your own transmission, buy your own transmitter, stick it up a mast. We did a spec for Dan at Oxford, a transmitter, one-off cost, to cover the whole of Oxfordshire, £25,000, plus your installation fees and your site fees and the rest of it. Right, if Bob is ready, first of all we have to, this is Bob Hughes from the Society of Optometrists. His background, however, is not entirely in glasses and Specsavers, etc. He has a background in the media, worked for the BBC as a vision editor, is that correct? Picture editor, and was involved with things like the Companies of Mind Strike. He was a Member of Parliament for Harrow for a number of years and is now Association of Optometrists Chief Executive. And the reason that we've involved him is that he's been a tremendous supporter of this particular movement. And if he can answer one of the questions about where is the content going to come from, well, we were talking, Jamie was talking about commission programming. This is one of the answers to the problem about where the content is going to come from and what's going to come from. Bob.
Steve, thanks very much indeed. I mean, I'm sure a number of you are asking yourselves the question, why is it that we're sponsoring something like this that seems to be so far outside the range of what we would do as the Association of Optometrists? Well, I hope to be able to answer that question. But first to say, we're very pleased to sponsor this. The original idea was that we would be holding this conference in our what will be absolutely magnificent new headquarters. But I underestimated the ability of builders to spin things out beyond what anyone might regard as reasonable. But I hope you'll be able to have meetings and indeed further conferences in our facilities in the future. So why?
That's on video, so we've got that as well.
Absolutely, yes. So why? I mean, firstly, who are we? Firstly, we're an association. In medical terms, we're a bit like a cross between the British Medical Association and the Medical Defence Union, i.e. we're a trade union, as well as being a representative body, and we defend our members. We absolutely ferociously defend our members, and we usually win and take costs off people, which delights us. We've been around for a very long time. We started with a black and white newsletter 50 years ago. We now have a magazine that is glossy. It's the market leader, circulation over 20,000. And 3 years ago, largely because of my my own background in film and television, I wanted us to get into multimedia, and we started doing a lot of work on that. And there was somebody from Westminster University here. And I'm delighted to say that I'm a graduate of Westminster University in Harrow, and so is our editor-cameraman, multimedia editor, who is here. So we like to keep it in the family. So the big thing that we're interested in, of course, with all of this, is communicating with our members. That's been very much our focus, with newsletters, the magazine, which is a powerful tool inside our our industry, and of course multimedia, the website, which used to be a number of websites, now concentrated on one brand new website, and all the video that we do. But of course what we want to do is to communicate with the public, because what we want to be able to do is to tell people about the very important, we think very important, eye care messages and public health messages that aren't just going by default. And one of the problems, of course, is public and media perceptions. You know, I mean, there is the perception that a sight test is you go into an optician's, and if you pass the test, you're allowed to buy glasses. But of course, it's not quite like that. You know, this is health screening. These are things that can change people's lives. For instance, a sight test can mean avoiding sight loss. I think we'd all agree, particularly all of us being people interested in or part of television, people lose their sight. That's very serious for them, and it's very serious for us, because they can't watch the television anymore. And also changing the life expectations of children. You know, a child that doesn't have a sight test before they go to school may have sight problems that you don't know about, or the parents don't know about, and it will live with them for the rest of their lives when they could have been corrected. And that would live with them for the rest of their lives. So before going to school, you may change somebody's career potential. And we want to get those messages over. Now, we want to get them over in an acceptable way. So we think this is an opportunity for us. But we are a £2.5 billion sector. Specsavers are 40% or so of that market in the UK. So we're about the same size as instant coffee. The instant coffee market is 2.5 billion. And therefore we can't do generic advertising on television or billboards or anything like that. We also have to face the whole concentration on negatives. You know, the British media, when they're not busy tapping people's phones, concentrate on negatives. And you know, I understand that. I worked, you know, I was 14 years in BBC Television News. I understand about the need to concentrate on negatives. But nevertheless, you know, frankly, rip off Britain, trying to analyse why it is that people pay so much for glasses, didn't actually get into the facts about what was going on, and we face that all the time. So we have to try and get beyond those negatives and get our messages out to people. And mostly, the messages that are out there, you know, Specsavers advertising or Boots or anybody else, is mostly about product, because that's where most of the money comes from. And so what we want to do is to target audiences. And we think there's a number of opportunities. Last year we did a campaign with Mumsnet about return to going to school for the first time, and we'll be running a bigger campaign this year. But we think that digital access channels is a real opportunity, as I've said, and to get health messages over. And so, now we don't have any tight ideas, we haven't done the financing, but we've looked at it in global terms. And we've looked at what are the opportunities that might be there. Now, providing the regulatory framework is right, providing that there is the ability to have advertising, we think there is a possibility that we could produce high quality, entertaining programme that's got our messages in. Not just us alone, but us, say, working with the pharmacists and the dentists and the chiropractors and other people like that. And I'm certain what is true about our broad clinical sector would be true of other sectors as well. That you've got this impetus, that we can put the money together. And I think this could be profitable, frankly. Now, we're not in it for profit, we're in it to try and get messages across. But I think it would certainly be able to pay for itself and potentially produce a profit. And certainly I think the idea of using university facilities and indeed because of the affordability, the ability to have high production values, and indeed the training opportunities for the people at the universities, I think could be very good indeed. And I think what I'm talking about could be tailored to be local in feel and indeed to have advertisers from that. And so, yeah, just finishing. So, I mean, I'm sure you're all familiar with these figures. I think some of the stuff is stunning. Let me give you one example, and it's not because I'm a former Tory MP that I give you this. I just think this is really interesting. David Cameron did all these web-based television programmes, live on the web, and then obviously available as recordings. He did one about the NHS, which I took part in. It was up for 2 weeks, 40,000 people submitted questions. I think that's stunning for something that got very little publicity indeed, and it just shows you the power of these things. And so I think there are opportunities here. I think there's opportunities for journalists, opportunities for the public, opportunities for sectors like mine, and we want to be associated with what you do going forward.
Thank you very much.